This medication contains two hormones, an estrogen called ethinyl estradiol and a progestin called drospirenone. It is used to prevent pregnancy. In addition to preventing pregnancy, birth control pills can also help make periods more regular, decrease blood loss and painful periods, and reduce the risk of ovarian cysts. It's important to note that using this medication does not protect against sexually transmitted diseases. Before starting Yasmin 28, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, with or without food, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day, 24 hours apart. Taking this medication after your evening meal or at bedtime may help decrease stomach upset and nausea. Follow the package instructions to find the first tablet and take them in the correct order. Do not skip any doses, as pregnancy is more likely if you miss pills, start a new pack late, or take your pill at a different time of the day than usual. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills at the end of the pack. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take a reminder pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period usually within 3 days after you take the last active tablet in the cycle. After you have taken the last reminder pill in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change, these are common side effects of Yasmin 28. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, inform your doctor. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Yasmin May 28. Raise your blood pressure. It's important to check your blood pressure regularly and inform your doctor if the results are high. Be sure to tell your doctor right away if you experience any serious side effects, including unusual changes in vaginal bleeding or symptoms of a high potassium blood level, such as muscle weakness or slow/irregular heartbeat. This medication may rarely cause serious problems from blood clots, such as deep vein thrombosis, pulmonary embolism, stroke, or heart attack. Talk to your doctor about the risks and benefits of this birth control pill. Seek medical help immediately if you experience symptoms such as sudden shortness of breath, chest/jaw/left arm pain, unusual sweating, confusion, or other serious symptoms. Also, seek medical help immediately if you experience lumps in the breast, severe stomach/abdominal pain, dark urine, yellowing eyes/skin, or mental/mood changes. In rare cases, a serious allergic reaction may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice other effects not mentioned, contact your doctor or pharmacist. If you're over 35 years old and use tobacco, it's important not to take Yasmin 28 because smoking can increase the risk of serious problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like Yasmin 28. It's important to avoid smoking or using tobacco while taking this medication to reduce the risk of these serious issues. It's important to talk to your healthcare professional about the best time to take this medication and the daily dosage that is right for you. Before taking Yasmin 28, it's important to let your doctor or pharmacist know if you have any allergies to ethinyl, estradiol or drospirenone, or any other estrogens or progestins. Also, inform them about your medical history, especially if you have any of the following: adrenal gland problems, stroke, blood clots, high blood pressure, abnormal breast exam, cancer, blood clotting disorders, diabetes, severe headaches/migraines, heart problems, kidney problems, liver problems, history of yellowing eyes/skin during pregnancy, unexplained vaginal bleeding, high cholesterol or triglyceride levels, depression, swelling, or gallbladder problems. If you have diabetes, make sure to monitor your blood sugar regularly and inform your doctor of any changes. Also, let your doctor know if you are planning to have major surgery or will be confined to a chair or bed for an extended period, as these conditions can increase your risk of getting blood clots. It's important to inform your doctor of all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. Yasmin May 28 increase your potassium levels, so consult your doctor before using potassium supplements or salt substitutes that contain potassium. This medication may cause blotchy, dark areas on your face and skin when exposed to sunlight, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses, so be sure to contact your eye doctor if these problems occur. It may take longer for you to become pregnant after you stop taking Yasmin 28, so consult your doctor if you have any concerns. Yasmin 28 should not be used during pregnancy, and if you become pregnant while taking this medication, inform your doctor right away. If you have just given birth or had a pregnancy loss/abortion after the first 3 months, talk with your doctor about reliable forms of birth control and find out when it is safe to start using birth control that contains a form of estrogen, such as this medication. Finally, this medication passes into breast milk and may affect milk production and harm a nursing infant, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Yasmin 28, as they may change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Yasmin 28 include aromatase inhibitors, atazanavir/cobicistat, fezolinetant, fosamprenavir, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Drospirenone, one of the ingredients in Yasmin 28, may raise your potassium blood level. Be sure to inform your doctor if you are regularly taking other drugs or products that can also raise your potassium level, such as aliskiren, ACE inhibitors, angiotensin receptor blockers, heparin, NSAIDs, and potassium-sparing water pills/diuretics. There are also some drugs that may cause hormonal birth control to work less effectively, potentially leading to an increased risk of pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug, be sure to inform your doctor and discuss whether you should use additional reliable birth control. Additionally, it's important to tell your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. Yasmin May 28 also interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much Yasmin 28 and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. Canadian residents can call their provincial Poison Control Center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's crucial to seek immediate medical attention in these cases. It's important not to share Yasmin 28 with others. When taking this medication, it's important to have regular complete physical exams, which may include lab and/or medical tests such as checking your potassium blood level, blood pressure, breast exam, pelvic exam, and pap smear. It's important to follow your doctor's instructions for examining your breasts, and report any lumps right away. Make sure to keep all medical and lab appointments, and consult your doctor for more details. If you miss a dose of Yasmin 28, refer to the product package for instructions on what to do. It's important to use backup birth control, such as condoms or spermicide, to prevent pregnancy if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist for guidance. If you frequently forget to take your pills as directed, it's a good idea to talk to your doctor about possibly switching to a different form of birth control. It's important to store Yasmin 28 at room temperature, away from light and moisture. Make sure to keep it out of the bathroom, and always keep medications out of reach of children and pets. When it comes to disposal, do not flush Yasmin 28 down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to dispose of Yasmin 28. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.